It is a question that absolutely everybody wants to know. When are you going to go into labor? And I totally get it. It was a big anxiety point for me as well during my pregnancy. Today, we're going to go through a quiz that gives you some ideas on when you might go into labor, although nothing is like a crystal ball. So, although maybe a crystal ball is not even like a crystal ball, but let's get started. But first off, you want to make sure that you're learning from an expert, and I am an expert. Hello, I'm Hilary. I'm the pregnancy nurse. I've been a nurse since 1997. I have 20 years of labor and delivery experience, plus 3 babies of my own. Plus, I am a naturally anxious person, so I really wanted to know when those babies come out, and I totally understand if you are wondering as well. And really quick, this video is sponsored by the online prenatal class for couples. If you're looking to get prepared for all of your delivery, it is the class for you. It goes from 3rd trimester testing all the way through your first weeks and months postpartum. It is the all-in-one birth class for you. And it's super affordable, so check it out. Okay, how did I make this quiz? Well, I wanted to come up with some questions to ask yourself if labor is near. And you might find that some of them are a little bit weird and you're not sure what to do with them. And this first question, you're going to be like, what the heck does that have to do with it? So question number 1, how much water have you drank lately? I have noticed that there are so many people out there with a very irritable uterus who think they're going to go into labor soon when in reality, they're just dehydrated. And that's something that I saw time and time and again as a nurse. And so making sure that you're hydrated kind of lets us know if these contractions are more real or if you're maybe just dehydrated. Now, a lot of people are like, yeah, but if I'm dehydrated, then I'll contract and the baby will come out. But these irritable contractions are not doing anything. They are just your uterus being irritable. And we all know how that feels when we're 9 months pregnant, right? So how much water have you drank? Hopefully you're looking to get 8+ glasses of water a day. Personally, I try to get that water in before dinner and then I'd have a glass with dinner and then try and cut myself off because I didn't want to pee all night. You just want to make sure that you're getting super hydrated during the day. Next question, how is your GI tract? That means your stomach. Have any nausea, any diarrhea, anything like that? Now, a lot of people don't know that that can be a sign of labor. Of course, it can also be a sign of bad Chinese food or Mexican food or whatever food that you made. But a lot of times when you're going into labor, your GI system, that's your gastrointestinal system, aka your tummy and your intestines, wants to clear itself out to give baby more room. Also, your body doesn't want to be working to digest things at the same time that it's working to push a baby out. So all of that is your body working together to try and help it get the baby out. So if you've had stomach troubles, nausea, diarrhea, possibly even some vomiting, that could be a sign that labor is near. It could also be just really crappy. I agree. Okay. Next question, how many weeks are you? Because if you're prior to like 36 weeks, we do not want you to have any of these signs or to be going into labor. Now, of course, you might have some stomach troubles, but if you are having contractions, you need to call your provider because they are going to want to stop those. We really want babies to stay in until at least 37 weeks if possible. So call your provider if you're having signs or symptoms of labor prior to 36 weeks. And the reality is most people don't have preterm labor and you're not going to have the baby prior to like 37, 38 weeks. A lot of people are looking for those signs like as soon as they start their 3rd trimester. And of course you want to watch for preterm labor, but also it doesn't mean you're going into labor. So you got to just be careful of that one. Okay. The next question is your cervix dilated? And a lot of you might have been checked at the office. A lot of times when they do your beta strep at 36 weeks, they'll say, hey, do you want me to check your cervix? Some of them, sometimes they don't. And sometimes you don't want to be checked, which is totally fine. But if you've had your cervix checked, it can be an indicator that things are starting to open up. Caveat, of course, I walked around at 4 to 5 centimeters for weeks. So it doesn't mean that labor is starting, but it does show that your cervix is starting to open up. If you've previously had a baby, a lot of times your cervix is going to be a little more open than if you've never had a baby. So just some things to know about, but if your cervix is starting to open up, if it's starting to thin out, then that can be a sign that labor might be sooner rather than later. Okay, next one. How frequent are your contractions? Have you timed them? Are you frequently having contractions? Now, if you're not having contractions, that doesn't mean that contractions can't start anytime now. But if you are having contractions, how frequent are they? Are they just once or twice an hour? Or are you getting more than like 5 in an hour or 10 in an hour? I actually don't recommend starting to count how frequent the contractions are until you're getting around 10 in an hour. I think it's best to just ignore them as long as you're past 36, 37 weeks. because contractions are going to come and may not mean that labor is coming too. It's super annoying. I totally get it. A lot of people want to know about, is it a Braxton Hicks contraction or is it a regular contraction? And the reality is they are the same thing. However, regular contractions push you into labor. That's the only difference. So it might be a Braxton Hicks contraction. It might be a regular contraction, but either way, I would just ignore them until you're getting more than 5 to 10 in an hour. Once you hit that time frame, then you might want to time them or make your partner time them. That is a great job for partners. Quick fun anecdote, the Count the Kicks app, which is how you can easily do kick counts, also includes a contraction timer. So if you're looking for a great app to download to monitor your labor signs, that might be a good one to download. Count the Kicks. Okay, the next question is, do you think your water is broken? Now, this seems like it would be really clear. Like it's super clear in the movies, right? 1 minute dry, next minute faucet, right? It's just whoosh. But it is not as clear as that for a lot of people. As you get later into pregnancy, your discharge is going to change in a very annoying way. A lot of people are just wearing a pad during the day because things are different down there. So if you think your water has broken, you always want to talk with your provider. One of my pro tips is that water doesn't usually just gush once and then completely dry. It usually keeps coming out because your amniotic fluid is made of baby pee. So it just keeps coming out because we know that babies just keep peeing. If you think that your water is broken, you do need to call your provider because that can be a source of infection. If your water has broken, that is a sign that labor is going to be happening pretty soon. Not always a sign that you need to go directly into the hospital though. Call your provider. Okay, the next question is, how painful are the contractions? Are they really painful? Sort of painful? The reality is, painful contractions is usually what makes your cervix open. A lot of times you'll get those like tightening contractions or they're easily talked through. You just kind of notice a cramp. And usually those contractions are not progressing that baby into the birth canal. That doesn't mean that they can't progress to that. That doesn't mean that they're not softening your cervix, but those early contractions that you really can talk through and they're just annoying usually aren't meaning that labor is progressing. Of course, if you think you're having contractions, especially before 36 weeks, you need to talk with your provider, and I would definitely mention it to them at your appointments. You might want to have your cervix checked. You might not, totally up to you, but I think it's important for your provider to know if you're having contractions or not. Okay, the next question is, have you lost your mucus plug? I go over this in so many videos, but I think it's a little bit misunderstood. So this is your uterus. Hopefully yours isn't crocheted. And at the end of it, there is a collection of cells and mucus that sort of corks it off to protect the baby from anything that comes into the vagina, right? And as your cervix starts to open up, as you can imagine, that cork sometimes falls out. Now, I only saw my mucus plug on 1 of 3 babies, and yes, it made me gag. I found it in the toilet after I had peed. A lot of people find it after they wipe. So if your mucus plug has fallen out, it can be a sign that labor is in the next couple of weeks. It is not a sign to go directly into labor and delivery, even though I have had patients come directly into labor and delivery because the mucus plug came out. It is also no reason to take a picture and send it to us or bring it over in a Tupperware container. But your mucus plug can be a sign that labor is coming. And yes, it is very gross. Amen. Okay, the next question is, what stops the contractions? A lot of times people will have contractions while they lay down, but when they move, they stop. Or they'll have contractions while they're moving, and when they lay down, they stop. But true labor does not stop if you're laying down or you're moving. That's the annoying thing about it. So if your contractions stop when you lay down, probably not the real thing. Or if your contractions stop when you start moving, probably not the real thing. It's a great sign to make sure that you're getting enough water though, because a lot of times uterine irritability can show up that way. Okay, that's a quick little quiz kind of to see if you're in labor or if labor is going to be soon. I hope you guys found it helpful. If you want to take the full quiz, I'll put the link down below. It's on my sister's site, Pulling Curls, because curly hair. But I think there's a lot of labor signs that people just don't really talk about. Contractions seem to get the top billing, but there is more to be watching for. So I hope you guys found this helpful. If you did, please give this video a like and subscribe so we can hang out for the rest of your pregnancy. I have lots more videos about labor progression, so I hope you'll enjoy some of those too.